Hello, everyone, and welcome to our module on hypoxia. So the term hypoxia refers to decreased oxygen delivery to tissues. So let's talk about what determines how much oxygen is delivered to the tissues in our body. Well, the first thing is the cardiac output. Obviously, you need to pump enough blood to those tissues in order to supply them with proper oxygen. And then the second thing is the oxygen content of blood. If you're pumping blood from the heart, but it's deprived of oxygen, then that's going to lead to hypoxia also. So the bottom line, although this is fairly obvious, but we need to say this at the outset, is that for proper oxygen delivery to tissues, we need a normal cardiac output and we need a normal oxygen content of blood. So let's talk about what determines the oxygen content of our blood. Well, it's determined by three things, and they're all shown on this slide. The first one is the amount of dissolved oxygen. This refers to oxygen directly dissolved in the blood, not oxygen bound to hemoglobin, oxygen directly dissolved in the plasma. And this depends on the PaO2, which is the partial pressure of oxygen in our arterial system. And we're going to talk more about this in just a minute. But only a small amount of the oxygen in our blood is dissolved oxygen. Most of the oxygen we carry in our bloodstream is bound to hemoglobin. So that means the second thing that determines our oxygen content of our blood is the hemoglobin concentration. If a person has anemia and there's a decrease in hemoglobin, that's going to reduce the amount of oxygen in our blood. And then beyond the hemoglobin concentration, oxygen content also depends on hemoglobin saturation. This is called the SaO2. It refers to the percent of oxygen-bound hemoglobin in arterial blood. So even if you have a normal amount of hemoglobin, if it's only 50% saturated instead of, say, 90% saturated, that's going to affect the O2 content of the blood. And as we'll see in just a minute, this important SaO2 value here, the hemoglobin saturation, also depends on PaO2, just like the amount of dissolved oxygen does. So let's talk about the PaO2 because this term is a very important concept in pulmonary physiology. So PaO2 refers to the partial pressure of oxygen in blood. It's obtained from an arterial blood gas test. This means a sample of blood is withdrawn from an artery, usually in the arm, and it's sent to the lab for an analysis of how much gas is carried in that blood sample. And it reflects the amount of oxygen dissolved in the blood. So the more oxygen dissolved in the blood, the more the PaO2 will be when you send a sample of blood to the lab for an arterial blood gas analysis. And a normal partial pressure of oxygen in the arterial blood is greater than 80. And anytime the PaO2 gets low, that is the definition of hypoxemia, meaning low oxygen content of blood. And we'll talk more about this later. And then it's super important to understand that the PaO2 is important in and of itself for determining how much oxygen is dissolved in blood, but it's also very important because it determines the SaO2. So when the PaO2 goes up or down, that's going to make the SaO2 go up or down. If you look at this graph on the right side of the screen, this is a hemoglobin-oxygen dissociation curve, and I go through these curves in detail in another video. But what they show you is that as the oxygen partial pressure goes up, this is the PaO2 down here on the bottom, you get more saturation of hemoglobin. So anytime the PaO2 gets low, you're going to not only have a low PaO2 contributing to a low amount of oxygen dissolved in blood, but you're also going to end up with a low SaO2 as well. Very important to understand that these two numbers, the PaO2 and the SaO2, are linked. And the easy way to think about PaO2 is that it's normal when the lungs are working properly. This is how I've always thought about this concept. So when there's normal ventilation of the lungs and normal gas exchange and an absence of pulmonary disease, that will lead to a normal PaO2. So anytime you get a question and they ask you whether or not the PaO2 will be normal or not, just think about the person's lungs. Are they breathing at a normal respiratory rate and tidal volume? Is there any pathology in the lungs? If all those things are okay, then you're going to have a normal PaO2 in most circumstances. Let's talk about pulse oximetry. This is the way that we measure the SaO2 in patients. This is the way we determine the amount of oxygen-bound hemoglobin in the arterial blood. A pulse oximeter is a device that uses light in a photodetector to determine the SaO2. This is a picture of one being used on a patient's finger right here. And it's going to give you a number for the SaO2, which is a percentage, something like 70% or 80% or 90%. And that's the percent of hemoglobin that is bound to oxygen. And as we just saw on the last slide, this is related to PaO2. So when the SaO2 is low, that usually means the PaO2 is low as well. And so in clinical medicine, we only rarely measure the PaO2 from a blood gas sample because that takes time to do. Instead, what we usually do is just measure the SaO2 from a pulse oximeter. And if the SaO2 is normal, then we know the patient must have a normal PaO2, and that means there's an absence of hypoxemia. So now that we understand all that, we can talk about this equation shown on the slide, which is an equation you can use to get an actual number for oxygen content of blood in milliliters of oxygen per deciliter. And so according to this equation, the oxygen content of blood is equal to the oxygen binding capacity, and the binding capacity is 1.34 times the hemoglobin concentration. You then multiply this by the SaO2, and then you add the dissolved oxygen content of blood, and the dissolved oxygen content of blood is equal to 0.003 times the PaO2. Now, having shown you this equation, it's very unlikely they're going to ask you to actually calculate a number for oxygen content on your exams, but they are going to want you to understand the three elements that determine the oxygen content. And those are the three things I've bolded in red here. They are the hemoglobin concentration, the percent saturation of hemoglobin with oxygen, which is the SaO2, and then finally the PaO2. A normal oxygen content of blood requires these three things right here: normal amount of hemoglobin, normal PaO2, and sufficient saturation of hemoglobin, meaning the SaO2. These are the high yield things to know about this equation right here. And when you're talking about pulmonary diseases, you want to think of them in terms of these three elements right here. Is the hemoglobin concentration changed? Is the PaO2 changed? Is the SaO2 changed? That's how you should understand lung conditions that lead to low oxygen content of blood. Let's briefly talk about the three different terms: hypoxemia, hypoxia, and ischemia. So hypoxemia means a low oxygen content of blood. And as we've already discussed, the definition of hypoxemia is a fall in the PaO2, meaning the partial pressure of oxygen in an arterial blood sample. Hypoxia, on the other hand, means low oxygen delivery to tissues. You can have hypoxia from hypoxemia, but as we'll see in a minute, there are times when you can have hypoxia despite an absence of hypoxemia, meaning a normal amount of oxygen in the blood. And then finally, ischemia is a term we use when discussing things like strokes and myocardial infarctions, and this refers to the abrupt loss of blood flow due to some pathologic process. So as I said before, the definition of hypoxemia is a low PaO2, but because PaO2 and SaO2 go together in clinical practice, when a person has a low SaO2, then we say that they have hypoxemia. And that's because anytime we have a low amount of hemoglobin bound to oxygen, we know there must be a low PaO2. You can, however, as I just said in the last slide, have hypoxia without hypoxemia. And so shown here in this little table are common causes of hypoxia. Only one of them is hypoxemia. These other three right here are situations where you do not have hypoxemia, meaning you do not have a low PaO2, but nevertheless, there's low oxygen delivery to tissues. So this can occur in heart failure, anemia, and carbon monoxide poisoning, and we'll talk about these three things right now. So the definition of heart failure is a reduction in the cardiac output, and this is going to lead to a decrease in blood flow to tissues, and that causes hypoxia. But importantly, in heart failure, the oxygen content of blood is normal if there's no lung pathology. Some patients with heart failure have pulmonary edema. This is an example of lung pathology, and that can lead to a reduction in the oxygen content of blood. But many patients with heart failure simply have a low cardiac output. They do not have pulmonary edema. And so in those cases, the PaO2 and the SaO2, meaning the hemoglobin oxygen saturation, can be normal. And this means you can have hypoxia even though you do not have hypoxemia. So let's look at this table on the slide here. I'm going to come back to this table a lot. These are the kind of things you want to know at a basic level of what's causing the low oxygen content of blood in a given disorder. So in hypoxemia, there's a decrease in oxygen content of blood because of a low PaO2, which causes a low SaO2. The hemoglobin concentration is normal. In heart failure, as I said, if there's no lung pathology, you can have normal oxygen content of blood. There's no problem with hemoglobin. The lungs are working, so the PaO2 is going to be normal and the SaO2 is going to be normal. The entire problem is a low cardiac output, but that is causing hypoxia. Let's talk about anemia. So in patients who have significant anemia, the oxygenation of their blood is normal, but the oxygen carrying capacity of blood is reduced because there's a reduction in the amount of hemoglobin. This means they're going to have a low oxygen content of blood, but they will not have hypoxemia. Their PaO2 and their SaO2, meaning the hemoglobin oxygen saturation, is going to be normal. So once again, let's look at this chart on the slide here. So in anemia, you have a low oxygen content of blood because of low hemoglobin, but the lungs are working fine. There's no lung pathology, so the PaO2 is going to be normal, and the SaO2 is also going to be normal. You are saturating hemoglobin normally. It's just that there isn't as much hemoglobin as there should be, so even though it's fully saturated, that still represents a reduction in the amount of oxygen in the blood, and that's because of the anemia and the low hemoglobin. And then lastly, let's talk about carbon monoxide poisoning. So in actual practice, this is a very rare cause of hypoxia, but it comes up a lot on board exams, so you want to understand the physiology behind this problem. So carbon monoxide binds to the iron in heme with 240 times the affinity of oxygen. So it's going to very avidly bind heme and block oxygen from binding hemoglobin. This creates what's called a functional anemia. You can think about this like an anemia. It's just like you're taking away hemoglobin from the patient by filling up that hemoglobin with carbon monoxide so there's no room for oxygen. Now, the lungs are working properly in carbon monoxide poisoning. Even though they're inhaling this gas, the amount of carbon monoxide gas required for poisoning is very small. So mostly the lungs are inhaling the normal amounts of oxygen. So the alveolar oxygen content, the P big AO2, is usually normal in patients exposed to carbon monoxide gas. Because they have a normal P big AO2, this is going to oxygenate the blood normally, and they will have a normal P little AO2. P little AO2 is the arterial partial pressure of oxygen. But then the SaO2, the amount of oxygen bound to hemoglobin, is going to be reduced because carbon monoxide is blocking the ability of oxygen to bind to heme. So even though you have a normal PaO2, you will have a reduced SaO2 in carbon monoxide poisoning. And this is sort of the one exception to the rule that SaO2 and P little AO2 usually go together. They almost always go together, but carbon monoxide is an exception where you can have a normal PaO2, but your SaO2 is reduced because of the carbon monoxide gas. And over here is the oxygen hemoglobin dissociation curve and how it's affected by carbon monoxide poisoning. And I go through this in detail in the video on hemoglobin. So as I said on the last slide, in carbon monoxide poisoning, there's a low SaO2 because carbon monoxide is blocking oxygen binding sites. The confusing thing you need to know about this disorder, though, clinically, is that when you use the pulse oximeter device that we saw a few slides ago, it's going to show 100% or normal oxygen saturation. And that's because the pulse oximeter can't distinguish hemoglobin bound to carbon monoxide from hemoglobin bound to oxygen. So it's going to falsely read 100% or normal or fully saturated hemoglobin, even though the SaO2 is actually low. So because the SaO2 is low, the oxygen content of blood is reduced. And therefore, the only way you really make this diagnosis is you have to do a special blood test called a co-oximetry test, which can separate carboxyhemoglobin from oxyhemoglobin. And you'll see a high level of carboxyhemoglobin in patients with carbon monoxide poisoning. So once again, let's look at our table at the bottom of the slide here. In carbon monoxide poisoning, the oxygen content of blood is reduced. There's no problem with hemoglobin. The concentration is normal. The lungs are working normally, so the PaO2 is normal. And then the SaO2 is reduced, although I put a little asterisk here because it's going to read normal by a photodetector, even though actually it's reduced. And as I said, normally PaO2 and SaO2 go together, like in all these other disorders I'm circling here. Carbon monoxide poisoning is sort of the one exception where you can have a normal PaO2, but a decreased or abnormal SaO2. And so up here at the top of the slide, I've summarized the things you want to remember about carbon monoxide poisoning. There's a normal PaO2. There's a low oxygen percent sat, the SaO2 in reality, but you'll get a normal reading from the photodetector. And then there's hypoxia because of the decreased oxygen content of blood. And that concludes our module on hypoxia.